Hi everyone, I'm Dr. J.K. Hairston and I am a child, adolescent, adult psychiatrist, also infant psychiatrist, which means children under 5. I welcome you to this video because today we're going to talk about suicide because this is Suicide Awareness Month and it is a topic that we shouldn't overlook. Just like the people who are in the throes of emotional angst, it's important that we not overlook. It's important that we do our best to reach out to people. And most people may or may not find themselves in that situation. But I do want to say that if you are in a situation, one where you are contemplating it, there's hope. There's a lot of organizations. First, I would like to mention the 988 hotline, which you can call at any time, 24 hours a day, 365 days a year, so that you can talk to someone right away in crisis. And it's really important to reach out. As a doctor, I have worked with people in the hospital who have tried to reach out again and again. And one of the highlights of those times is when the person I'm working with actually is getting better treatment than they have in the past. Like, all experiences aren't the same, all doctors aren't the same, all therapists aren't the same. So I just really want to encourage you all to not give up. Please don't give up. And then also, the best thing that other people can do who are not in that position but want to help is really just be quiet and listen. And listen to their pain, don't judge it. Just don't judge it. Take them to a professional who has some empathy, some care in their heart, so that they can be heard, so that they can get the right help. If someone was bleeding profusely, the first thing we would do is stop the bleeding and then take them to a hospital emergency room so that someone who is capable of treating the problem, handling the problem, can now take it from there. So I really want to address that really most people aren't qualified to deal with that situation, but you are qualified to listen and to just listen and to try to get the person to help. And listen without judgment. You can do that. And I think that's one of the best things you can do. And I really think that we should become aware that this is not between 1 and 11, 1 and 19. People will contemplate it. So let's be gentle with each other. Let's give room for them to just be who they are and to give them the space to be able to talk confidentially with someone so that they can express themselves and be themselves. One of the things that I've noticed clinically is that people experience pressures from their external environment. Usually is the people around them, their family and their friends, and that external pressure can become too much, especially when the emotional pain is too great, and especially if someone has been in a state of mind where they have experienced helplessness and hopelessness and anxiety for far too long. That coming out of that state of mind can be quite a struggle and quite a battle, and it can take time, and it will take time. So once again, I'm just really asking people to be patient with themselves and kind and gentle towards others, because these things take time. It's not a quick fix. I prescribe medications all the time, and the medications, even my fastest medications outside of stimulants, but outside of them, depressions, mood stabilizers can take 1 to 2 weeks to really start working, and the depressants can take 2 to 4 weeks. So, that's a month of pain. So let's be kind, let's be gentle, let's be patient, let's be non-judgmental, let's be helpful, let's be useful, let's encourage people to do their best and not be hard or harsh when people make mistakes, because we all make mistakes. We all don't want to take our medicine sometimes, and just be gentle and encouraging to people. So this is what I want to say during Suicidal Awareness Month, is that the importance is awareness that is all around us, and that we do not know how the words we speak are going to impact someone else. So choose our words carefully, be helpful when we can, listen when we can, and always just observe and let go of the judgment, because it doesn't help them, it doesn't help you. We don't get to be the judge and jury on someone else's life, and to really believe that you are really says more about your own narcissism than it does about the other person. So in terms of judgments, let's just hold off on that and have an open mind and be helpful. As a psychiatrist, this is my request of you all. I hope that some of this will resonate with you. If anything, call 988. It can save a life. And we really want you all to be able to make it, to be encouraged and live life fully and thrive. That's what I want for each of you listening to this, that it's okay. Falling down is okay. Get back up. This pain and sadness, whatever state of mind, it will all pass. Just hang on. Just keep hanging on. Thank you so much, and I appreciate you watching this video. See you next time.